morning to everyone. Thank you to be here. I would like to thank the organizers of this Congress committee to invite me here, and I'm very happy because I'm with very good friends. I would like to say some things about about the problem after the surgery, because this problem is well known to us, and let's see what is going on with this. Okay, I would say some things about frozen shoulder, but my colleague before said some many things about this, and we don't have enough time to say things about this. We know about cause; it's unknown the cause of the frozen shoulder. Sometimes diabetes is one of the cause. That and other disease we can say secondary immobilization, stiffness, fracture, and sometime surgery. Symptom and status it's well known, I think. Freezing, frozen, and thawing. Physical exam, imaging text, sometimes the X-rays, MRI, ultrasound is useful to recognize what the problem is. Treatment, we can say non-surgical treatment and surgical treatment. Of course, non-surgical treatment is a physiotherapy. The previous year, before the surgeon do something about this, is a problem that takes us a long time, of course, because we know that is a problem with a long time period to heal it. Surgery is a good treatment. Especially in a person that have a serious problem and wants to be again in their life, because some people don't want to do an operation and decided to try to do a physiotherapy. Of course, there are many special exercises which help restore motion. This may be done under the supervision of a physiotherapist or via a home program. It's very important, the two of us, and the physiotherapy and the homework, of course. Let's see the manual approach after the surgery. The case analysis, I told you before, and say rehabilitation. For me, for the first day after surgery, we have to start the passive movement. It's important to maintain the range of motion, because after the surgery, the operation, let's say, there is full range of motion, as Mr. Antonio said, and it is our ability to maintain this range of movement. Of course, this has to be in a low pain, with no pain or a little pain. And we have to teach the patient, as my colleague said, that okay, the pain is pain. The pain is nothing in this situation. Has to be in let's say in more movement in your shoulder, and if you want to maintain the range of movement. Passive movement and mobilization in all directions with almost no pain. Okay, control the scapula is very important, because we need a stable ground to move the humerus. Rhomboid, serratus anterior, trapezoid, and all the muscle that keeps the scapula on the rib is important to activate, to have a stable ground, and have the, let's say, the very good goal, good achievements. Of course, we have to take care with forearm supination and shoulder abduction, because as we see, we have a small, let's say, interaction, intervention with long head of biceps, as I understand, and the supraspinatus. Of course, we have to take care about this. Of course, for the 2 or 3 weeks. Activate movement with help after 3 weeks, in my opinion. For the first 3 weeks, we can do only passive movements to protect the intervention that that Mr. Antonakis did. Of course, gradual activity movements after 5 of 6 weeks to be safe. Take care with tenodesis of biceps and repair supraspinatus and inflammation, of course. We have said that we have to give the advice to the patient to move, let's say, every 2 hours her hand, to do, let's say, 10 repetitions every 2 hours, passively, to maintain the rates of movement that we have done before. Because if the patient comes the next day or the day after, before to 2 days after, and I think it's not good because we'll be back. Of course, we have to be gentle, because if we will create pain in the patient, because it's chronic pain, starts to keep her hand on his body, and the problem is big, of course, in this situation. Targets of sources, maintenance of the range of motions, improve the movement, and improve the strength. It's very important. Of course, the strength can be after 5 months, 5 weeks, 6 weeks, of course. Let's see some examples of manual techniques that I can use. Is a technique that can improve restricted flexion with a glide. As you can see, we try to stretch the opposite side of the capsule. Restricted abduction with glide here to stretch the down side of the capsule. Here we have to try to restrict the front side of the capsule, restrict extension and internal rotation with glide. Scapular movement is a very important thing, as I said, very important. Sometimes we forget about this, but I think that it's the most important, because we need, as I said, stable ground. Restricted flexion and extension, abduction with traction in this technique is very useful, especially when we have, let's say, when we are doing a physiotherapy without surgery. Here we have a restricted internal rotation. Is a combination movement with traction in the shoulder, and try to put the hand behind the back. Of course, PNF is very useful in the second and third stage. First passively, and then passively with help, and at the end active movements is very useful, because we have to activate in the brain. Is the movement that the people, the human being knows. Of course, we have to do some passive movements with stick that the patient can take in the home, can do homework every day, every two hours. For me, is very important. And as I can see, and I don't know the other colleagues said, is very useful, because I'm old in this as a physio. The first year I didn't do this. I didn't say to the patient, okay, every 2 hours do this. Okay, do once in a day, let's say. But when I was doing when I was saying to the patient, okay, every 2 hours, I saw very good outcomes. Passive movements is well-known movements. It's a simple movements. Sometimes I prefer to give simple movements to my patient, because 2 or 3 exercise, because every time I gave 5, 6, 10 exercise, my patient didn't remember the exercises and do nothing. 3 exercises, 3 simple exercises to do her, let's say, for her homework. Thank you for your attention.